Good.
All right, Mr. Scott, Johns Hopkins University Nuclear Medicine Technology Program. I'm going to give a quick in-service on venipuncture. So I have one of my students here, Giovanni Moore-Smith, who is going to be my patient. So the first thing you want to do when you come into the department and you have a patient, you want to introduce yourself. Like, hi, my name is Aaron. I'm going to be your nuclear medicine technologist. I need to get some information from you. Could you give me your first and last name and your date of birth?
Giovanni Moore-Smith, July 31st, 1988.
All right, now that you've done 2 patient identifiers and you've introduced yourself, one thing I always like to do as a courtesy, and being that I'm from down south, I always like to shake my patient's hand. And it's just a little sign of respect from one person to another. So now I want to go ahead, clean my hands. And one of the things you want to do is actually do this in front of your patient. Even if you've done it right before you entered the room, do it again, because that lets the patients know that your hands are clean. And a lot of times on the survey, when the patient gets a survey at home, they'll ask them, did the person taking care of you clean their hands? And even though you did it, they didn't see you do it, so therefore it was never done. So go ahead and don your gloves. I have all of my materials out here laid out, so what I like to do, I like to get 2 10cc saline flushes. And trash, I'll just throw it in the trash can. I've got a 22 gauge angiocath, IV tubing, chloroprep, Tegaderm to keep the IV in place, Coban to secure it once I have the IV out, alcohol prep pads, and gauze. Go ahead and open up my gauze. And so, sir, what we're going to do today is called a nuclear medicine bone scan. Have you ever had this done before?
Yes.
Good deal. So my patient is familiar with what we're going to do, so we're not going to go into the explanation of the bone scan. Do you have a preference as far as which arm I use for your IV?
My left arm.
All right, good deal. I'll have you rest your left arm right here on the table. So after I have my patient's arm secured on the table, what I like to do is have something to elevate the arm so it will actually hyperextend and have the veins nice and straight. Take your tourniquet, put it around roughly about mid-bicep, secure it. Is that too tight? Are you okay?
That's good.
All right, so the patient has confirmed that it's not too tight. One thing I want to do is just go ahead and have the patient make a nice tight fist and hold it and look for what veins look good for me. So for right here, I'm going to go for this vein right here into his left antecubital. So first thing I need to do is go ahead and clean the area. I'm going to do this with an alcohol prep pad first. I like to start out in small circles and kind of work in the middle and work my way out. Then I'll do the same thing with my chloroprep. Break the seal, shake it up, start in the middle, start rubbing till I start to see moisture, and work my way out. Now, I'm going to take one of my saline flushes, break the seal, and get all the air out of the tubing. Take my line and prime my line to make sure that there's no air in the line. Release my cap and keep it into the sterile field. All right, uncap my needle, do a small twist to make sure that it's able to unlock and slide. We're good to go. Make sure that it's bevel up, which means for this type of needle, you want the wings down. And so, I see which vein I want to go into. All right, Mr. Moore, the way I'm going to do this, I'm going to say 1, 2, 3, stick, and then access the vein, all right? So that way the patient knows when you're coming at him. So, 1, 2, 3, stick, take the vein, and you're going to look for the flash, and that's the blood that's going into the hub right here. Now that I see the flash, I don't need to advance the needle anymore. I'm going to take my index finger, slide this forward until the blue part of the IV gets flush with the skin. Now that that's done, pull back until you hear the click, and that way you know the needle's all the way retracted. All right, sir, go ahead and relax your hand and release the tourniquet. You want to go ahead and release the tourniquet because you don't want to start cutting off the patient's circulation and making them uncomfortable, and there's no need for the tourniquet anymore. So I'm going to take one of my gauze, stick it underneath the IV, and then very quickly disconnect with a twist and reconnect with the IV tubing. Some people will hold pressure here to make sure that there's no blood coming out, but I like to use a gauze to take care of my mess. So, holding this in place, I'm going to pull back to see if I can get any blood in the tubing, and I do. So I will flush the blood into the patient in the saline and ask the patient, do you feel any burning or stinging?
No.
All right, so the patient does not feel any burning or stinging. So, at this point, I will take my Tegaderm, secure my IV, and double secure it with the Tegaderm. All right, we have our radioactive dose here, which for this case is technetium MDP, 25 millicuries right on the dot. What I'm going to do is uncap my radioactive dose, sit my needle down, uncap my saline, secure my dose to the tubing, and flush into the patient. So it delivers the dose, recap my radioactive dose because I don't want to contaminate my table, take the remaining saline, flush into the patient. Still no burning or stinging?
No.
Good deal. Deliver the whole entire dose because that'll get it into the patient's system, and plus you want to make sure that there's no leftover radioactive material that's left inside the tubing. Go ahead and clamp because now we're not going to give any more fluid into the patient. Take your other gauze. I like to fold mine twice to give it a nice good thick layer, and remove your Coban. Sorry, Tegaderm, my bad. Now, once you get to the point where all the adhesive is off and the needle is still in, cover your injection site where you pierce the skin, pull back nice and easy. Use your Coban to hold pressure and tell your patient to hold pressure right there. And holding pressure will stop the bleeding, and if the patient is on any type of anticoagulant, it'll be necessary to help the bleeding stop as well. And that is how to successfully start and administer an IV and radio tracer and to withdraw your IV.